What do you do if the initial pressure is too strong? Pressure is too much for me to handle? Try this. There's something in your machine called the ramp setting. What ramp does is it keeps you at a lower pressure for a specific amount of time that you set. You can set it for 5 minutes, 30 minutes, all the way to 45 minutes. And the pressure will start to ramp up. Say, for example, the pressure is set at 10. Your CPAP pressure will stay at the lowest level that you set at. It'll stay at a pressure of 4 until 30 minutes. Then it'll go up to the pressure of 10. That ramp setting will buy you 30 minutes of time to go to sleep, to fall asleep with the machine on, because it's a low pressure, so it's nice and comfortable. After you've fallen asleep, that pressure will ramp up to 10. You wouldn't even notice it. Okay, just make sure the mask straps are nice and tight, because yes, you have a good mask seal at a pressure of 4, it's perfect. But once it ramps up to 10, it could be stronger, so make sure it's tighter, a little tighter than it was. CPAP stands for continuous positive airway pressure. So you're actually getting positive pressure pushing into your airways to keep that airway from collapsing when you're sleeping. So when the doctor sets the starting pressure of 10, you need that pressure of 10 to keep your airways from closing. But sometimes that pressure may be too strong for you. So this ramp setting, which I'm going to show you, can help. Stay there. You see, the pressure is set at 10 to 14, but it's staying at 4 because I set the ramp to a pressure of 4 for 30 minutes. So it's going to buy you 30 minutes of time to go to sleep until after 30 minutes, that pressure will ramp up to 10. This 4 here is the humidifier, so don't get confused. That has nothing to do with the pressure. It's the humidifier right here. It has to do with the humidifier setting. Okay? Some people get confused with that. They think that turning on the humidifier is increasing the pressure. Nope. So don't worry, you're not the first person. I'm here to help. You can do this. It's not the easiest thing to get used to, but I know you can. And CPAP really works. Trust me, I've seen thousands of patients, and I want you to get it. Once you get it, it works really well. So many things will work so much better in your life when you get good quality sleep. I know you can do it.